I'm Amy Hempfling. I've been a nurse for 3 years, and I'm currently working at Watauga Medical Center in our COVID intensive care unit. 100% right now in COVID-ICU at Watauga, they're all unvaccinated and all very sick. Since the surge has started with the Delta variant, our intubated patients have not been progressing well. They get intubated and they just don't do well. Then we're not able to wean them on the ventilator, and we've not had a lot of successful extubations, or meaning that we're not able to take them off of the ventilator and then breathe on their own well. And it's really hard to see your community members, people that you know, not do well. And today we had a community member that is well known be taken off of the ventilator, and she's breathing on her own, and I'm literally shaking and just so happy because she's someone very, very loved, and it just gives me hope. And I just watch her through the door, and I just can't wait to put my PPE on and go in there and hug her for her daughter and for her husband and for all the people that have been praying for her, because this is what we fight for every day as nurses and doctors and respiratory therapists. This is why we work overtime and put our PPE on every time we have to enter the room. This is why we fight for our community, because we want to see people get better.
My name is Michele Baldwin. I'm a registered respiratory therapist here at Watauga Medical Center. I'm currently working back in the COVID unit, taking care of, currently today we have 6 patients on ventilators. This is an endotracheal tube. This is the tube we put in your airway to breathe for you when you're placed on a ventilator. COVID patients tend to start here on heated high flow oxygen, and as their symptoms progress, we have to go up on that oxygen. Normal oxygen won't give them enough, so we go from heated high flow to BiPAP. When BiPAP fails, then they need an intratracheal tube, so they need a ventilator. So we put this in their airway, and for COVID patients, we are most at risk as providers during that process because of the particles being directly into our face. So we paralyze the patient. We try to take as much precautions as possible. We pass this tube down through their vocal cords and inflate the cuff, and then we put them on a piece of equipment called a ventilator. People can be on as much as 2 to 3 days, or unfortunately we've had people that we have not been able to get off of the ventilator. We have to make some hard decisions about cure times. What we're seeing right now is people are staging quicker through the progress of, with the Delta variant, they're getting sicker much faster. Their chest x-rays get worse much quicker. They actually need to be intubated quicker than the initial COVID strain. They're not coming off as easily or at all for most of the patients we've had. This week we've had 2 successful extubations, people taken off the vent, but unfortunately we've lost 5 in the last 2 weeks.
Please get vaccinated. Please get vaccinated. And if you don't believe in the vaccine, please isolate, respect the boundaries of people. Please wear your mask. Wear your mask. Stay away from people as much as you can, because this variant is unlike the other variants. It is extremely contagious and extremely infectious. It is affecting people younger than the other variants that we've seen. It's making people very sick, very fast, requiring higher levels of oxygenation, and they're being ventilated quicker rather than the other variants. So it's imperative that our community takes this seriously and takes all the measures needed to stop the spread.